Okay, so like I've said, bacteria are arranged in shapes and form of arrangement. So the chains, streptococci is in chain, the cluster is staphylococcus, and we have the one that are in pairs. They always go in two pairs. They are called diplococci, and the one that are arranged with four are tetrad. Then we have the one that are arranged side by side, like palisade. So those are the angel one, but we're just warming up. So the staining procedure in bacteriology or in microbiology, we're talking about five stain or six stain that are major one. The Gram stain is divided into positive and negative. And what the instrument that is normally used is crystal violet, iodine, alcohol, sulfur stain. So the ones that absorb the crystal violence and after the decolorization still take the violence is called the positive. They are the gram positive. But the gram negative, after you put alcohol in it, it will wash it off and it's going to be very transparent. But in order for us to see it, we put safranin and then it will appear pink. So to distinguish between the gram positive and gram negative is to use safranin to whichever stain purple is the positive, whichever stain is the pink is the gram negative. So acid fast, we have to note that all the mycobacterium, they have something called mycolytic acid. And then that acid makes them to have a very thick wall. And gram stain doesn't work for them. So what the procedure, and it's one of the things they said question on, carbofuchsin is used, alcohol, decolorization, methane blue as counter stain. So the acid fast one usually taking the carbofuchsin, which make them to turn red. So the acid fast stain and bacteria that have a very thick mycolic wall, and they cannot be stained by gram stain. So we use acid fast stain for them. Then the fluorescent stain are used to, like they are like fluorescent dye that they put in the organism, and when they check them under the microscope, it comes out as fluorescent. So it's used for mycobacteria too. So the interpretation of the organism when it's visible under the ultraviolet and it's showing fluorescence or light is fluorescent positive. So other stain that we have are the ones like we use in hematology, like Gemester stain, rice stain that we use normally. But for fungi, we use Indian pink for fungi. So when we prepare a slide, the best way when we stain, whether gram stain or acid fast stain, whatever stain, these are the things that we use to identify bacteria. Capsule, the zone of the capsule, we know whether the zone is thin or thick. When they are thick and they're stain negative, maybe from gram stain, we gram stain positive or negative, we're able to. Then the spore, what we use for the spore is to know the size, the shape, is it round, is it oval? And then the spore usually stain with mercantile grain. So we have to understand that the spore usually stain with mercantile grain and refractorial. So it can come because the spore are not easily destroyed. Whether you even disinfect them, they survive so many. I've seen a question on that that says the spores, there's something in the organism that cannot be destroyed. So, and the answer was spore. So then, why in the slide too, especially on mouth wets, we can use their flagella to distinguish them. With some of them have pili. Pili are like structure that help them to attach to the host and to soften the host. So some of them have flagella. So those are the things that we can use to identify them. And the quality control is very important in microbiology. Our regular media that we use, they have dates. When did you set it up? What time? Is it an aerobic one? So all these things are very, very important. Is it aerobic? Because some organism will not go without the right condition. So the quality control in microbiology lab is very, very important. Then instrument calibration, the routine calibration, it could be we should calibrate whether the autoclave, the pipette, the microscope, and the microscope is a big one because the calibration, sometimes the objectives We calibrate the objectives, the lenses for them to be very useful. After some time using the microscope, you just find out that things are not very visible, and they have to be calibrated and tested and be sure that they are working well. The sterility testing is the checking of uh, the medias that we use, whether they are sterile. It will be very, very absorbed to bring out the already contaminated media. And by the time you now use it and you put a patient's swab on it and you see something grow and you think it grew from the patient. So that's why we have to check that all the medias are not contaminated, neither the reagents. And if they are, we detect and then correct them. So the quality control in microbiology lab is very important. And the incubator, the temperature, the logging, the freezer, they are very, very important too. So those are the things that terminology, the curriculum wants us to talk about. And then as a personnel, we are going to make sure that we have competency and continual education that is going on. So that's that about terminology. We are going to go